Dr. Wegener, we're sat at home and suddenly, out of the blue, or seemingly, we've got a toothache. What do we do?
Well, toothaches are not fun. No one loves a toothache, but unfortunately, most people in their lifetime are going to have a tooth that starts to bother them. Really, the most important thing is to get in, have someone take a look at it, make sure that we catch the problem as early as we can. Now, sometimes that means it's almost too late. Sometimes when we start to feel something that hurts, too late meaning, well, now we need a root canal or something more invasive like that. But sometimes it's not. Sometimes it can be a filling that's become sensitive, something like that. But really, you can know at home, really, if a tooth it needs a root canal. And those symptoms are, a tooth that really starts to hurt or ache when you chew, or if you have we call it a lingering response to cold, or if you lay down at night to go to sleep and it starts to hurt. Those are kind of giveaway signs that a tooth needs a root canal.
So, but if you're having the odd twitch every now and then in your face, it's not really that important, but something might be brewing underneath the surface, and that's when we need to get in and see you.
Yep. Usually when you feel something like that, there's something significant going on. Okay. Now, there are some cases of sensitivity where maybe you're brushing your teeth or you get a cold drink and it's sensitive. Okay. We're all a little sensitive when we bite into the ice cream, but
right. And is that not a big cause? That's fairly common, I'm thinking, isn't it?
Fairly common, but sometimes it's abnormal to you. Maybe you bite into something and that's different. It's cold drink and now that's sensitive. So those would be something you'd want to come take a look at. But for the most part, sometimes those are pretty easy fixes. Okay. Maybe a small cavity is forming, and sometimes a small cavity, your first sign would be sensitivity to sweets. Oh. So you bite into a gummy bear and you feel it. You bite into those sticky candies and you kind of feel that little sensitivity.
Okay. And although you said it may be too late by the time we actually start to feel it, it's never too late to actually do something constructive about it, is it?
Exactly. So if you're feeling those sensitivities, you're having those pre-signs to an actual toothache, taking care of it while it's small and is always best, so we don't end up at the root canal word.
Canal.
Yep.
Yeah, so a root canal being on the very top end of the pretty nasty situation. What's on the lower end?
A lower end is a filling. Usually that can take care of most things. There's some desensitization procedures we can do to try and make teeth not sensitive if it's not a cavity. Okay. But then there's also things that you may be surprised, or we may be surprised, a broken tooth, a broken part of the tooth that's not kind of moving and causing some pain that may not require a root canal, but maybe a crown or a bigger filling. Okay,
so little or big, this is the place to come in and see Dr. Wegener and his staff here at Aspen Dental. Tell us where you are, Dr. Wegener.
We're at 1451 North, 200 East, and that's just right across from the Mountain America Credit Union, is right on the corner there. So
whatever you need, come in to Aspen Dental, and I'm sure they'll be more than willing to help you out and take a look. Thank you.
Thank you.